I'm Dr. Angela Mattke. I am a general pediatrician here in Rochester, Minnesota. And I think more importantly, since we're doing the Ask the Mayo Mom segment, I am a mom of two active boys. I have a 6-month-old and I have a 3-year-old. And I have to say that right now I'm living and breathing sleep problems. In my practice, I think the number one question that parents come to me about is about sleep problems that they're having with their young children. And that is not the exception in our house as well. The biggest question that I get is, when can parents start sleep training, and is it okay for them to let their infants learn how to self-soothe on their own? And the answer to that is yes, absolutely it's okay. And somewhere between 4 and 6 months of age is when most pediatricians will say that it's acceptable to let them start to self-soothe. After about 4 to 6 months of age, there really isn't a reason that they need to eat physiologically at night. They don't need it for their brain. They don't need it for their glucose levels. They should be able to go at least 8 hours at night without feeding. And so the next question that parents have is this going to affect my child emotionally if I allow them to cry a little bit or learn to calm themselves down and put themselves back to sleep? And my answer would be no, it's not going to affect their bond with you at all. It won't affect their emotional connection. It won't affect their development. And we've actually have good research that has actually studied this. And I think that can be reassuring, at least to me as a parent as well, to be able to say, you know what, they've studied this. These kids do well. They're just as well attached to their parents. They do as well in social settings as other kids. So if it's something that you and your family feels comfortable with, it's completely acceptable to do. And so right now I'm getting up the courage to start that myself with my 6-month-old, and letting him to put himself back to sleep a little bit more instead of always needing me to kind of come in and console him. Other questions that I get are related to sleep are what to do with the kid that wakes up at night and wants to come into your bedroom. And I think the first question you need to decide is that something that you're okay with? Do you want your child to be sleeping in your bed with you? And if that is something that you're comfortable with, then you can certainly continue to do that. But if your goal is to get your child to be able to go back to sleep on their own and stay in their own bed, then there are some techniques and things that we can do to kind of help coach you and your child to get to that point. Some things that work really well in children in general are using just positive reinforcements and praise and encouragement. When we tend to use negative reinforcements in children, it usually does not work as well for the general outcome that you want. And kids will have more negative associations with it. So your child is getting up at night, coming into your bedroom, you can start by maybe making a sticker chart and talking to them about every night that you stay in your own bed, you could get a sticker, and you ultimately are working towards a goal for them. Including your child in those goals and helping them to determine things that they're working for could really help with the engagement process being more successful long term. Some other things you can do is really talk to them before the bedtime happens, before they're tired and they have less ability to kind of use coping on their own. So spending time talking about it during the daytime, saying, we're going to practice staying on our bed tonight, instead of waiting until they're overly tired before bedtime. Other things that can really help is making sure you're getting your child to bed with a good bedtime routine. Now, I know just as well as everyone, bedtime is usually pretty chaotic in most houses, but trying to have a regular time that you all start to unwind is really important. Other things that can make bedtime more difficult is watching a lot of screen time before bedtime. We know that watching screen time, such as being on their tablets, computers, video games, or on their TVs, can really activate part of the brain and makes it harder for them to relax and unwind at night. So really trying to, at least the hour before bedtime, no screen time. Also trying to engage in activities that are kind of calming for them. So just telling stories or reading books together, taking baths, and having quiet music on instead of running around the house, playing tag and having dance parties and stuff like that. Trying to set expectations in advance, like I said before, is also really helpful.
Got a question here from one of our viewers. Is 7:30 to 7:45 a good bedtime for a 4-year-old?
Sure. I think it all depends on what time they are getting up in the morning. So, about a 4-year-old should have about 12 hours of sleep on average throughout the day, and that's a wide spectrum. So, normal can be anywhere from 10 to 14 hours. And so, if they're going to bed at 7:30 and they're getting up at 6, 7 o'clock, that seems completely appropriate. I think you have to base it on how your child acts. Are they tired in the morning when they get up? Are they tired throughout the daytime? If that's the case, then maybe moving the bedtime up a little bit. The best way to move the bedtime up is move it up by about 15 minutes every couple nights to get to your goal bedtime. So instead of making a huge adjustment, kids can slowly kind of readjust their sleep clock. So this will get better. The first thing you need to do is just be consistent about it. Try not to engage her too much when she wakes up at 3 or 4 o'clock in the morning. So keeping the lights low, not trying to smile and play and sing songs and those sort of things, if your goal is to try and get her back to bed. The first thing I want to know is if the family is comfortable with letting her kind of play in her crib on her own and seeing if she will fall back and sleep. Sometimes it can take very long time. Parents will use kind of progressively letting them be on their own a little bit longer each night, increasing it by about 5 minutes or so. Some families will do the cold turkey approach where they let them kind of fuss on their own. I'll check on them from the door, make sure that they're okay. And if they're doing fine, they'll leave them alone. I think that's certainly fine approach to do. Whatever you decide to do, if you have a partner that you are that lives at home with you, it would be best to kind of talk together, figure out what your approach is, and then stick to it. I think the hardest thing is in the moment being feeling weak and saying, "Oh, I'm going to go in and go pick my child up and we're going to go downstairs and stuff like that." So once you kind of break whatever your plan was going forward, you kind of have to start all over. Bedwetting is very normal, first of all. Up to about age 7 is where after about age 7 is where we start to say it's a little bit less abnormal when we look at the spectrum of how many kids are still having bedwetting problems at night. So we start to not really do any interventions until at least age 7 or later. This is something you want to talk to your pediatrician about or your family practice provider about, and kind of determining other questions, because there can be a lot of other confounding factors that contribute to it, like constipation. It's also very familial. So if there's a family history of bedwetting, it's about 40% chance likelihood that your child will also bedwet. And the age that the parent was able to become continent or not have any more bedwetting doesn't always correlate with when the child will as well. There's really some things that can help and be successful, and the most successful is called bedwetting alarms. One brand that I like that I get no endorsements for is called the Wet Stop 3. There's lots of different types, and you can go on lots of different websites, the bedwetting store, Amazon, many different places where you can buy different varieties, but it's consistency. And if you're using it consistently, it takes about a month or so of it being consistent before you can try to retrain their bladder. So initially they're going to urinate, it will wake them up, then you get up with your child, take them to the bathroom, and put them back to bed. Also, not making a big deal about it like you're already doing can be very helpful, but it slowly they will have less and less where they're waking up and already being wet, but more waking themselves up. And it can be an exhausting process, but really the key to it being successful is consistency, and you getting up with your child when they urinate, helping them try to completely empty their bladder if they hadn't when they had the accident. Can be most successful. There's medications that you can also use. These have less success long-term wise, but they can be very helpful. I like to use them for like sleepovers and things like that, so the child doesn't feel like they can't go and engage in these activities with their friends because they're afraid they're going to have an accident. And this is, again, something you should talk to your provider about. So I think a lot of it can start early on in life. So when you're starting to introduce solids around 6 months of age, kids are not necessarily always going to like what you give them. They're just developing their taste buds and what they like. And so just the first time that you would give them something and they may give you that I don't like it face, spit it back out. It can take up to 10 to sometimes 20 exposures to a food before kids can really develop a taste or a palate for that food. So continuing to offer it to them, not forcing it to them, but at least bringing it to their lips and trying to get them to eat it. Now as you go on, as they start to get older and they're feeding themselves more, other things you can do is make mealtime fun. So try not to have too many distractions, not have the TV on, but make what you're serving them look appealing. You can spice things up by giving them options about what they're eating with different dips, and so not necessarily asking them what they want to eat, but serving them the meal, but giving them options within the meal. Do you want to eat this first, or do you want to eat this first? If it's something they don't like and there's this particular dip that they like ranch dressing or hummus or something like that, you could offer that to kind of try to encourage them to eat vegetables. Again, positive praise can be really, really helpful. Even if the kid is very picky and there's something they won't try, just trying to get them to at least try one bite of it, giving them a lot of praise, and gradually keep offering that food. Just because they say they don't want it initially, by allowing them to kind of choose, they really start to self-select down to wanting to eat only a couple different foods. So continuing to offer them the foods and asking them to at least engage in taking a couple bites can be helpful in trying to increase their palate of what they'll eat later on. Keep trying. Keep trying, keep trying, keep trying, keep trying. Try not to make it forceful or like a negative experience for them. If they're younger, allowing them to play with it around 9 to 12 months of age, letting them experiment on their own with new textures and whatnot, but continuing to offer it over and over again, giving them praise. And then I mentioned earlier, trying to make it fun. If they're older kids, making it look like fun things. If it's peanut butter toast, putting a heart on the toast or putting their name in it. There's lots of things you can do that really require no energy, and even just doing a simple internet search to look for creative food ideas for kids can help you very quickly come up with some other ideas. In my house, the most important thing is incentivizing your child. So, you finish your meal, we can go outside and play quicker. Or I give them really simple choices. So my 3-year-old gets very simple choices. Do you want to have this dip or this dip? So they have the power in kind of choosing what they eat, even though I'm giving them the options with things that I find acceptable for them. The other types of milk that aren't cow's milk, like almond milk, soy milk, cashew milk, coconut milk, they have added calcium and vitamin D, and they have more added calcium and vitamin D because they're a little bit less absorbable for the amount of nutrients that you're going to get in them, and so more of it is kind of just goes through your system and is it excreted. And so you want to make sure that they're getting appropriate amounts of calcium and vitamin D and phosphorus that are added to these. I would still offer them cow's milk. At regular periods of time, just so they don't develop some type of lactose deficiency or excuse me, like a lactose intolerance. Excuse me, not a lactose deficiency. But I would just, like I said earlier about picky eaters, just continuing to offer it to them. I remember my oldest son did not like cow's milk for about the first 6 months that we tried it, and now he loves it, and I really have to limit it. One other thing I would add is that you really want to make sure your child isn't drinking too much milk, because that can also lead to picky eating. They get very full from their milk, and they tend to not want to eat their meals. And so trying to keep the milk to about 20 ounces to 16 ounces or less per day, because that'll be enough to give them calcium and vitamin D, but not enough to completely fill them up, and then they're not getting their other nutrient-rich foods at mealtime. I've been filling out a lot of forms for schools for asthma medications and for EpiPens for food allergies. And so making sure that your school has their asthma medications, their rescue medications such as albuterol available for your child if they're having symptoms. And also making sure that your school has their epinephrine device if they do have a history of food allergies with anaphylaxis, and making sure that your school is aware of your child's allergies and has the appropriate forms on file is very, very important. Also making sure that the cafeteria is appropriately serving your child the right foods so they're not going to be at risk for food allergy in that setting or in their classroom for snacks and things like that. You are not alone. I think this is, I hear this all the time. So it kind of depends on what the behavioral problem is that they're seeing, if they're tearful or if they're acting out. Things that you want to maybe look at is making sure, first of all, they're getting good sleep, that they're used to routine, and that the same kind of behaviors for encouragement of positive behaviors that they're doing in school that you're doing at home, so there's consistency across the board. So if you use timeouts, or if you use redirection, or if you use incentives, you want to ask the teacher what they're doing. Working with the teacher can be really helpful. They can set up kind of behavioral programs, or they can really encourage positive behaviors. Making sure that there's not like an underlying reason, like a medical reason why your child's having a hard time adjusting. Do they have some type of sleep problem? Are they having problems with constipation or belly aches? And also just knowing that this is a normal behavior. A lot of kids are going to struggle with that transition. It's a big thing to ask of them. They're going full days in most school districts now, and it can be really tiring on these little guys. And when they're tired, they're more likely to act out or be tearful. And so making sure they're getting good sleep on the weekends too, to kind of help with if they're behind on their sleep. Anything, a technical number for the fever is 100.4 degrees Fahrenheit or 38 degrees Celsius. And so anything below that is technically not a fever. And so a lot of times parents will use the grade low grade fever if it's 99 per se. I'm less likely to intervene if I'm worried about a fever if it's kind of low grade, as opposed to waiting before it gets over that kind of technical threshold for a fever. I've got a lot of questions about immunizations, about when people can get their flu shots, and I would say right now is the perfect time to get your child immunized for influenza, starting now over the next couple months. Influenza season usually peaks in the winter time, somewhere between December and March. Last year we had an early peak in December. Other times, depending on when the strains circulate, it'll be later. So now is the perfect time. It takes at least 2 weeks before their immune system fully responds to the flu vaccine and gives them the full immunity. So getting it before the flu is widely spread in your community is very, very important. A lot of schools will offer influenza in the schools. That's one thing in Rochester that our school district is doing. So you can inquire about that, but otherwise bring them to your clinic or pharmacy to get the flu vaccine is very, very important. Routine shots that are recommended based on where you live in the world or in per states required is something that to look up and make sure that you're getting those done. I can't stress immunizations enough and how much they've really have helped prevent some of the diseases. And I've had so many parents come in and saying, oh, I wish I would have got my child the influenza vaccine when their child has influenza, because it's 7 to 10 days of high fever, missed school, missed work for them. They're miserable, and there's really nothing we can do to make them feel better quicker. And so get your flu vaccines. So the CDC, if you're in the United States, has great information on vaccines. The WHO, if you're worldwide, has good information on vaccinations. One of my favorite immunization sites is the Immunization Action Coalition in the United States, and has great information for parents. It has information for providers, information about everything from religious concerns to vaccines to concerns about vaccine safety, regular vaccine schedules. Another excellent website is called Every Child by Two, and that is really has an effort to try to get all children immunized by 2 with their regular vaccine schedule. Mayo Clinic also has great resources on vaccinations, but kind of looking at what your country or what your state has for requirements can also be helpful too. A common concern that parents bring to me is that they worry that there's too many vaccines too early, and they worry that there's too many antigens that the children are being exposed to. And so first of all, there's not too many antigens they're being exposed to, and it's not too many shots too early. These are just very false statements made by people who may be well-meaning but don't have the information necessary. The vaccine series that we give before age 2 has about 350 antigens in it total, and all of the shots that they get in the first 2 years of life. Now you can compare that to maybe the first breastfeed that a child gets when they have a lot of antibodies in that colostrum. That's much more antigens that they're being exposed to just in their very first breastfeed, and if you add that up, the number of breastfeeds that a child gets in the first day of life, that's 10 of them, and that's a multiple fold increase in the antigens that they were exposed to in the entire first 2 years of vaccine series. They've actually looked at studies about how many antigens or how many shots would it take to overwhelm the immune system of a child. And it would need to be 10,000 vaccines at once to overwhelm the immune system. And we talk about we're probably giving a total of maybe 15 shots total over the first 11 years of life, and that's very, very small amount. People also have concerns about what the vaccines contain in regards to antigens and preservatives. Most people do not use the thermocell-containing vaccines at all anymore. I know we stopped using those many years ago. Other concerns that people have. I think if people don't want to vaccinate, they tend to sometimes find a reason for it. But sometimes the reasons necessarily don't have evidence or just are false in general. I know they're very, very safe. I feel so strongly in vaccines that the very first day my child can usually get the vaccine, I make sure that they get it just so they can be protected, because I've seen how devastating these illnesses can be. I would just say get your child's immunizations up to date. It's the best way to keep them healthy, keep them in school, prevent you from missing work. And then there's just a very simple phrase that we use with making healthy lifestyle choices in kids. And so it's trying to get 5 servings of fruits and vegetables per day, having 2 hours or less of screen time per day for your child. And if they're getting less than 2 hours of screen time, they're going to be getting more exercise. And our goal is at least 60 minutes of exercise for all kids. And then what they drink during the day is 0 sugary drinks. We want them to really drink just milk and water, and save the other stuff for special occasions, because I think you want to teach your child everything in moderation. And then the last thing is our goal of about 9 hours of sleep in a school-age kid per day.